Okay. Hi, everyone. Today's topic is yoga and mental health. And as usual, it's a pleasure to be presenting Lamsa's Wednesday webinars. The topic that was chosen today was actually picked because Monday was International Day of Yoga. And it was celebrated all across the world in different regions. And I think it's a practice that's very well appreciated for both its effects on physical and mental health. And you'll see why. So, the key points for today's webinar. So first, what is yoga? You all clearly know what it is. Just a quick reminder, a few brief definitions to make sure that we all have the same idea of what I'm talking about. Then we're going to see that yoga is a useful tool for mental health and see how far we can ask that question. Then how to reap the benefits of yoga, how to incorporate yoga into your daily practice. And then we're going to ask ourselves if yoga can actually be used as a prescription for any mental health issue. So first, what is yoga? I think you all know that it's a pretty ancient practice and it's known to bring together mind and body. It's derived from a word in Sanskrit called yuji, which means union or holy. And it clearly talks about the union of mind and body and how both can correlate and be involved in a specific practice. And through this practice, you incorporate breathing exercises, meditation, poses, and even more gradually, we're starting to incorporate weights and making it harder and harder and adapting it to different levels. So it's encouraged to induce relaxation, reduce stress, make sure that you get to a more peaceful state of mind. Many studies, as we'll see later, prove that yoga is actually very, very helpful for that. And I think that's an idea that we all think of when we think of yoga. And we don't only think of relaxation or reducing stress. We also think about flexibility. Yoga is seen as something that's difficult, like difficult poses, something that needs concentration, focusing on your breath, and overall just promoting a sense of peace. So there are different ways that yoga can be seen, and it can look different. So it's either going to be very complicated poses, something very advanced that focuses a lot on balance, or meditation. You can see yourself by the beach, for example, relaxing, breathing in and out, just following your breath and the rhythm that it is. Or a mix of both. Complicated poses by the beach clearly works also. But more realistically, when people go to yoga class or start their yoga practice, they look something like this, because yoga is not a very easy thing to do. And although it looks very gracious and composed, most of yoga class you'll see is about balance, and it doesn't always look very pretty. So the main types of yoga are first hatha yoga, which is what's made for beginners. It focuses a lot on your breath, and it encourages beginner poses or exercises that in yoga language are called asanas. So you just sit in the room, you breathe, you lay down, you focus on your breath, and you learn how to control that. This is a type of yoga that's encouraged for beginners. It's encouraged if you want to focus on your breath and just relax overall. Vinyasa is also, it's a bit more advanced than hatha, but it can be recommended for beginners to intermediates. This is where you start linking your breath and movement. So you go through a lot of different poses, different sequences that gradually throughout the session become harder and harder. So Vinyasa is recommended for flexibility because you start off slow and then slowly but surely you get more flexible. Other types of yoga can include hot yoga. So you sit in a hot room and you do the usual hatha or vinyasa. So the usual yoga movement, except that it's in a hot room, so it induces more sweat and it can make you work more and just sweat more overall. And there is power yoga, where it's very, very difficult poses, pretty advanced type of yoga, where you can use even weights. So for example, now there's something that's called the hot sculpt yoga that you can do actually in a hot room, and you have weights, and it helps you tone your body and shape your body overall. So it's not just about your breath, it's also about exercise and making you have a good workout. So we have found through various studies that yoga can almost be as effective as other interventions such as relaxation or cognitive behavioral therapy, TBT, or dance, CBT, or dance, in reducing your overall stress. So it is starting to get more and more recommended as a mean of just calming you down overall and reducing your stress. It has also been shown to decrease your secretion of cortisol, which is your primary stress hormone. And this is very, very helpful in your overall body chemistry, brain chemistry, and just making you feel more at peace. So there are a lot of studies that correlate yoga and different mental health topics. So throughout the presentation, I'll be going through different case studies and showing you how everything works and how helpful yoga actually is. So the first study follows 24 women who thought they were emotionally distressed. And they went through a 3-month yoga program. And after that, we measured their levels of cortisol. So before and after, how much stress can be seen in their body and how much cortisol there is. So after this 3-month yoga program, the women had significantly lower levels of cortisol, which shows that physically their stress reduced. So they also had lower levels of anxiety, fatigue, and depression, showing that yoga clearly helped. Another study followed 131 people through 10 weeks of yoga. So they had a specific program, and after that, they saw that there was a significant reduce in stress and anxiety. Improved quality of life, as expected. These studies are showing the same ideas that yoga is very, very helpful in managing your stress. So it could be a good idea if you're feeling pretty stressed to start incorporating yoga into your daily practice because its effects are very, very beneficial and can help calm you down. In terms of anxiety, it has also been shown to reduce it. So when 34 women that were diagnosed with anxiety disorder participated in the yoga class twice weekly for 2 months, we saw that at the end of that study, the ones who had participated in yoga had a lot lower levels of anxiety than the control group, which shows that this practice helped them control that anxiety. Because in the control group, clearly no one was doing yoga and they probably had the same stress levels. Another study followed 64 women with PTSD. And after 10 weeks, they all had lower levels of PTSD, and 52% of them actually no longer even met the criteria for PTSD. So yoga was kind of the cure to their PTSD, if I can say, and it helped fix that problem. So also very good for anxiety and overall calming you down. So we don't really know how yoga does this, how physically moving and breathing will reduce your symptoms of anxiety and reduce your levels of cortisol. But a good theory says that as long as you can be present in the moment and try finding a sense of peace, whether it's through movement, so for example, power yoga, or just through breath, so hatha yoga, you can help treat your anxiety and calm yourself down. So in terms of if you're not just thinking about mental health issues like PTSD and other things, you're just thinking about quality of life. As someone who might not be stressed, you can start incorporating yoga into your daily life just to be able to improve the quality of your life. And when you use yoga with any sort of other therapy, it has been proved to increase your quality of life by a lot. So when 135 seniors were assigned 6 months of yoga, walking, or nothing, so the control group. So we see that in this case, there's also another form of exercise, which is walking. And this is how you can tell that yoga is the one that's contributing to the success. Because even though some of the seniors were walking, only the ones who were practicing yoga had an improved quality of life or reported an improved quality of life on a specific scale. So They all had better mood, less fatigue, and they were even better compared to any other groups. So it's not just any form of exercise in this case that had improved their mental health and quality of life. It was specifically yoga through again this sort of breathing patterns and movement. Now, a lot of the studies that are coming up show patients undergoing cancer and how yoga can improve their mental health and eventually their treatment. So when we studied women who had breast cancer and that were undergoing chemotherapy, we saw that yoga decreased these symptoms, and the women that were actually doing yoga while following chemo had less nausea, less vomiting, and had improved quality of life. So yoga is starting to be not prescribed, as we'll see later, but yoga is starting to be recommended and suggested as another modality that will help women in their treatment or help any person undergoing chemotherapy, because it does help with symptoms and it does help relieve the side effects of chemotherapy that are often not very desirable. And another study that looked at how yoga affected women with breast cancer showed that overall these women had less fatigue, felt more energized, and felt more accepting and relaxed when it came to their treatment and their prognosis and how they were doing. So we have other studies that also show clearly that it's going to help with your sleep, it's going to enhance your spiritual well-being, improve social function, and just in general, anxiety and depression in patients with cancer. But there aren't enough studies yet that prove how effective and how much we can rely on yoga in order to proceed with it as a form of treatment. So, yoga and depression, we found a link that says that with patients with depression, yoga helped them control their breathing because it focused on rhythmic breathing. But after, so during this study, we saw that patients with depression who focused on that rhythmic breathing had lower levels of ACTH, which is responsible for the release of cortisol, so a stress hormone. So the lower your levels of ACTH, the lower your cortisol, the lower your stress. So in patients with depression, yoga clearly works. And it's starting to look more and more like yoga is a good alternative for treatment. In randomized controlled trials, we also saw that yoga has beneficial effects for treating depressive symptoms. And as you may have seen, the trend throughout this presentation has been that yoga is extremely, extremely, extremely helpful for your mental health. But as I've been saying all along, the data seems insufficient. So we cannot conclude whether or not there's substantial clinical justification. There are a lot of studies out there, but we just can't conclude it yet. And what we know is that yoga has benefits. So what we want to do is reap the benefits of yoga and not just use it or practice without a specific cause or a specific goal. So the way you can reap those benefits is by incorporating yoga into your lifestyle. So you can slowly start, for example, adding 30 minutes of yoga every day. If you don't have 30 minutes every day, it's fine. You can go for 15 minutes, so on and so forth. You can do an hour a day. You can do an hour every 3 days, whatever works best. And what's important here is for you to adapt your practice to your level. Because as a beginner, you don't want to be trying very complicated poses because that's just not going to improve your mental health overall. You're going to feel stressed that you're not doing the poses correctly, and you're just going to add extra stress on yourself versus relieve the stress, which is the effect that we want from yoga right now. So you adapt your practice to your level, you stick to a beginner level if you are a beginner, and just stay consistent in your practice. There's a saying that says consistency over perfection, because even though you can be perfect once a year, if you're at 80% of what you can do, but 3 times a week, it's so much better. So if you're consistent in your practice, chances are you will reap the benefits of it. You can also set an intention at the start of your session. So whenever you go into that breathing mode, what you can say is, okay, I have a goal, for example, by the end of the day, I want to feel more calm, and center your practice around making you feel more calm, or set practical goals. And by the end of the day, you want to have finished whatever on your to-do list, and just focus that 1 hour of your time or whatever you're doing to that intention. I'm assuming there are a lot of beginners out there. So you can follow a guided practice. There are great ebooks, great YouTube channels, for example, Yoga with Adrienne, Boho Beautiful, that have very, very easy videos to follow. And you can really learn from that. And other Instagram accounts that obviously help a lot. What's most important here is for you not to add pressure on yourself, because you can decide to do yoga 3 times a week and then feel pressure to show up. And this is not what you want. You want it to become more natural, be part of your lifestyle, and make sure that whatever you're doing it for the benefit of yourself and not just because you have to. So if you remove any external source of stress, it's going to help you a lot. Now, there there are a few doctors out there and a few scientists that think that yoga can be used as a first step in the treatment of anxiety or depression. So they're saying that maybe we can start prescribing yoga as a treatment. And many people clearly think that if you're not going to therapy, if you just go do some yoga, it'll help, it'll calm you down. So here, for example, even in a movie, uh, she says they haven't completed their therapy, give them a pill and sign them up for a sport. So you can't just do that. And this is what's being shown lately, is that yoga in itself is good for stress and it improves mental health. But what we need to know is that it's not reliable enough to be used as therapy on its own. So if anyone has major symptoms of depression or major symptoms of anxiety, you can't just ask them to go do yoga and everything will disappear. That's not how it works. You can use yoga in parallel to your usual course of treatment. Keep going to your therapist, use the traditional route of treatment, but maybe adding yoga to that is what's going to make it work and is what's going to help. So this is how yoga is going to help the most. And this is how I think it should be used. Clearly, it has great mental health benefits, but it cannot be supplemented to the usual course of treatment. Not yet, at least. So if you have any questions, feel free to ask. Feel free to share your ideas and your thoughts, and let me know what you think. Okay. So thank you everyone for attending. It's a pleasure as usual to present. And as usual, you can email me. You can ask your questions on Lamsa's Instagram page, and we will answer everything and make sure you get the right answers.